Every 40 seconds, someone in America has a stroke. Would you recognize the warning signs? Today we're sharing life-saving facts about stroke prevention that every senior must know. Welcome. I'm here to share critical information about stroke, the 5th leading cause of death and #1 cause of long-term disability. This knowledge could save your life or someone you love. A stroke occurs when blood flow to part of the brain is interrupted or reduced, depriving brain tissue of oxygen. Within minutes, brain cells begin dying. Time is critical. About 795,000 Americans suffer strokes annually. 3/4 of all strokes occur in people aged 65 and older. Your risk doubles every decade after age 55. The good news? Up to 80% of strokes are preventable through lifestyle modifications and managing risk factors. Today, you'll learn exactly how to protect yourself starting right now. Today we'll cover stroke types, the FAST recognition system, major risk factors, prevention strategies, what happens during stroke, recovery facts, and when strokes strike during sleep. Critical information everyone needs. If this information could save a life, please hit that like button. Help other seniors and caregivers find this critical stroke awareness content that everyone should know. Types of stroke. First, let's understand stroke types. There are 2 main types of strokes: ischemic strokes caused by blood clots blocking arteries, and hemorrhagic strokes caused by bleeding in the brain. Ischemic strokes account for 87% of all strokes. They occur when blood clots or fatty deposits called plaque block arteries supplying blood to the brain, starving brain cells of oxygen. 13% of strokes are hemorrhagic strokes but are often more severe. They happen when weakened blood vessels rupture and bleed into or around the brain, causing dangerous pressure and damage. There's also a warning event called a TIA, transient ischemic attack, or mini-stroke. Symptoms are temporary, lasting minutes to hours, but this is a serious warning sign requiring immediate medical attention. 1/3 of people who experience a TIA will have a major stroke within 1 year if left untreated. Never ignore TIA symptoms. They're your brain's warning alarm that demands action. Stroke symptoms. Now, the most important acronym you'll ever learn: FAST. This simple tool helps anyone recognize stroke symptoms and respond immediately. Every second counts when stroke strikes someone near you. Face. F stands for face drooping. Ask the person to smile. Does one side of their face droop or feel numb? Is their smile uneven or lopsided? Face drooping is a classic stroke warning sign. Arm. A stands for arm weakness. Ask them to raise both arms. Does one arm drift downward or can't be lifted at all? Arm weakness or numbness on one side signals stroke. Speech. S stands for speech difficulty. Listen carefully. Is their speech slurred or strange? Can they repeat a simple sentence clearly? Speech problems, including slurring, are major stroke indicators. Time. T stands for time to call 911. If you observe any of these signs, call emergency services immediately. Note what time symptoms started. This timing is critical for treatment decisions. Some experts now use BEFAST, adding 2 more warning signs. B for balance loss, sudden trouble walking or dizziness. E for eyesight changes, sudden vision problems in one or both eyes. Other stroke symptoms include sudden severe headache with no known cause, sudden confusion or trouble understanding speech, and sudden numbness anywhere in the body. Don't ignore these signs ever. Subscribe to our channel now for life-saving health information delivered weekly. This content could help you recognize emergencies and take action when seconds count most critically every day. Meet Dorothy, 72, who woke up with a funny feeling. Her left arm felt heavy. She assumed she'd slept wrong and waited. 4 hours later, her stroke had caused permanent left side weakness. Dorothy's delay cost her recovery. Had she called 911 immediately, doctors could have administered clot-busting medication. The treatment window is just 3 to 4.5 hours from symptom onset. Dorothy says, "I thought it would pass. I didn't want to bother anyone. Now I'll never fully use my left arm again. Please don't wait like I did. Call immediately." Stroke risks. Now let's discuss major stroke risk factors. Some you cannot control: age, gender, race, family history. But many risk factors are controllable through lifestyle changes and medical management today. Risk factor number 1, high blood pressure. This is the number 1 risk factor for stroke, doubling or even quadrupling your risk if uncontrolled. 74% of stroke risk involves high blood pressure. Blood pressure over 140/90 is considered high. Ideally, aim for less than 120/80. Have your blood pressure checked regularly and take prescribed medications consistently every single day. If you're on blood pressure medication, never skip doses. Missing medication causes dangerous spikes. Work with your doctor to find medications that work well for you without intolerable side effects. Risk factor number 2, diabetes. Diabetics have stroke risk 2 to 4 times higher than non-diabetics. High blood sugar damages blood vessels over time, making clots and strokes more likely to occur. Control blood sugar through diet, exercise, medication, and regular monitoring. Keep hemoglobin A1C under 7% if possible. Better diabetes control means dramatically reduced stroke risk for life. Risk factor number 3, high cholesterol. Excess cholesterol builds up as plaque in arteries, narrowing blood vessels and restricting flow to the brain. This increases stroke risk significantly over time progressively. Have cholesterol checked annually. If elevated, your doctor may prescribe statins, highly effective medications that lower stroke risk. Combined with diet changes, statins can reduce risk by 25 to 30%. Risk factor number 4, atrial fibrillation. This irregular heartbeat causes blood to pool in the heart, forming clots that can travel to the brain. AFib increases stroke risk 5-fold. That's 500%. If you have AFib, heart palpitations, shortness of breath, chest discomfort, see your doctor. You may need blood thinners called anticoagulants to prevent dangerous clots from forming in your heart chambers. Risk factor number 5, smoking. Tobacco use accelerates clot formation, thickens blood, increases plaque buildup, and damages blood vessels. Smokers have double the stroke risk of non-smokers. Quit smoking today. The good news: stroke risk begins dropping immediately after quitting and reaches non-smoker levels within 2 to 4 years. It's never too late. Ask your doctor about cessation aids today. Risk factor number 6, obesity and physical inactivity. Being overweight increases blood pressure, cholesterol, diabetes risk, all stroke contributors. Sedentary lifestyle compounds these risks dramatically over time consistently. Aim for 30 minutes of moderate exercise most days. Walking, swimming, cycling, gardening, anything that gets you moving helps. Combined with healthy eating, activity reduces stroke risk by 20 to 30%. Risk factor number 7, excessive alcohol consumption. Heavy drinking increases blood pressure, promotes AFib, contributes to obesity, and raises stroke risk. Moderate is key. 1 drink daily for women, 2 for men maximum. Like this video if you're learning critical information that could save your life. Share with family members who need this stroke awareness education desperately starting today without delay. Question: can young people have strokes? Yes, though less common. About 10% of strokes occur in people under 50. Risk factors include drug use, blood clotting disorders, and congenital heart defects. Now let's talk about stroke prevention strategies. Prevention strategy. Number 1, control blood pressure religiously. Monitor at home, take medications consistently, reduce sodium intake, manage stress, maintain healthy weight, and exercise regularly every day. Prevention strategy number 2. Manage diabetes effectively. Check blood sugar regularly, take medications as prescribed, eat a balanced diet low in refined sugars, exercise, and work closely with your healthcare team always today. Prevention strategy. Number 3. Eat a heart-healthy diet. The Mediterranean diet reduces stroke risk by 30%. Focus on fruits, vegetables, whole grains, fish, olive oil, nuts, and limit red meat dramatically. Limit sodium to less than 2,300 milligrams daily. Avoid processed foods high in salt. Choose fresh, whole foods. Cook at home where you control ingredients and sodium levels. Prevention strategy number 4. Exercise regularly. Physical activity lowers blood pressure, helps control weight, improves cholesterol, regulates blood sugar, and directly reduces stroke risk by 25 to 30% significantly. You don't need intense exercise. Moderate activities like brisk walking, water aerobics, dancing, or gardening count. Consistency matters more than intensity. Move your body most days every single week. Prevention strategy. Number 5. Maintain healthy weight. Losing even 5 to 10% of body weight significantly improves blood pressure, cholesterol, and blood sugar, all reducing stroke risk dramatically over time. Prevention strategy number 6. Limit alcohol consumption. If you drink, do so moderately. 1 drink daily for women, 2 for men. Consider red wine, which may offer some cardiovascular benefits when consumed moderately. Prevention strategy. Number 7. Quit smoking and avoid secondhand smoke. Smoking cessation is one of the most powerful steps you can take. Resources available. Call 1-800-QUIT-NOW or visit smokefree.gov for help. Prevention strategy number 8. Take prescribed medications faithfully. Blood pressure pills, diabetes medications, cholesterol-lowering statins, blood thinners. These work only if taken consistently. Set daily reminders if needed today. Never stop or change medications without consulting your doctor. Sudden changes can cause dangerous spikes in blood pressure or blood sugar. Always discuss concerns with healthcare providers first, always. Meet Robert, 68, who knew he had high blood pressure but hated taking pills. He'd skip doses frequently. At his grandson's birthday party, Robert suffered a massive stroke that left him paralyzed. Robert's stroke was entirely preventable. His blood pressure medication would have protected him. Now he requires full-time care and can't play with the grandchildren he adores. Medication compliance saves lives. Robert says from his wheelchair, "I thought I was too young for a stroke." "I was wrong. Take your medicine. Don't end up like me. I'd give anything for another chance." What happens during a stroke? When blood flow stops, brain cells die rapidly, 19 million brain cells per minute. Immediate treatment can stop damage, restore flow, and save brain tissue from permanent death. Clot-busting medication called TPA must be given within 3 to 4.5 hours of symptom onset. This dissolves clots and restores blood flow, dramatically improving outcomes if administered in time. Some patients qualify for mechanical thrombectomy, a procedure where doctors thread a device through arteries to physically remove clots. This can be performed up to 24 hours after symptoms in selected cases. The faster treatment begins, the better the outcome. Patients treated within 1 hour have significantly better recovery than those treated at 3 hours. Every minute matters. Time saved is brain saved. This is why recognizing symptoms immediately and calling 911 is critical. Ambulances take you to stroke-certified hospitals equipped to provide specialized emergency treatment that saves brain tissue and lives. Never drive yourself or have someone drive you to the hospital. Calling 911 alerts the hospital that a stroke patient is coming, allowing them to prepare the team and treatment before you arrive. Share this life-saving information. Every person who learns fast and acts quickly can save someone's life or prevent devastating disability. Spread this knowledge throughout your entire community today. Stroke recovery. Now let's discuss recovery. Recovery varies greatly depending on stroke severity, location, how quickly treatment was received, and individual factors like age and overall health before the stroke occurred. About 1/3 of stroke survivors recover almost completely. 1/3 have moderate disability requiring some assistance, and 1/3 have severe disability requiring significant ongoing care and support daily. Rehabilitation is crucial for recovery. Physical therapy restores movement. Occupational therapy rebuilds daily living skills, and speech therapy addresses communication and swallowing difficulties that strokes can cause significantly. The brain has remarkable plasticity, ability to rewire and compensate for damaged areas. With intensive rehabilitation, many stroke survivors regain substantial function, though recovery takes months to years of dedicated work. Recovery continues for 18 to 24 months after stroke, though most dramatic gains occur in the first 3 to 6 months. Don't give up. Continued effort brings continued improvement over time. Question: can strokes happen during sleep? Yes. About 20% of strokes occur during sleep. You wake up with symptoms already present, having missed the critical early treatment window, unfortunately. Wake-up strokes. Wake-up strokes present challenges because doctors can't determine when symptoms started. Without known symptom onset time, patients may not qualify for TPA treatment that requires precise timing information. However, advanced brain imaging can sometimes identify patients who might still benefit from treatment, even with unknown symptom onset. Specialized stroke centers have this technology. Always go to the hospital immediately. If you wake with stroke symptoms, note the time you discovered them and call 911 immediately. Don't assume it's too late. Let doctors determine eligibility for treatment. Every case is different. To reduce wake-up stroke risk, control blood pressure, especially before bed, avoid heavy evening meals, limit alcohol, stay hydrated, and ensure sleep apnea is treated with CPAP if you have this condition. Meet Patricia, 73, who went to bed feeling fine but woke unable to move her right side. Her husband immediately called 911. Despite the overnight timing, imaging showed she could receive treatment. Advanced imaging revealed Patricia's stroke was recent enough for thrombectomy. Doctors removed the clot, and Patricia regained most function. Her husband's quick action despite overnight timing saved her recovery prospects. Patricia says, "I'm so grateful my husband didn't hesitate. We both thought maybe it was too late, but calling anyway was the best decision." Don't wait. Call immediately regardless of timing. Stroke in women. Let's discuss stroke in women. Women have unique risk factors including pregnancy complications, preeclampsia history, birth control pills, hormone replacement therapy, and migraine with aura increasing stroke risk significantly. Women also experience some different stroke symptoms than men: sudden hiccups, nausea, chest pain, shortness of breath, and general weakness. Women are more likely to die from strokes than men are overall. African Americans have nearly twice the stroke risk of white Americans. Hispanics also have increased risk. These disparities relate to higher rates of diabetes, hypertension, and obesity in these communities. Addressing health inequities requires community education, access to health care, culturally appropriate prevention programs, and targeting risk factor management in high-risk populations proactively and compassionately, always today. Question: can stress cause strokes? Chronic stress increases stroke risk by raising blood pressure, promoting unhealthy behaviors, and triggering inflammation. Manage stress through meditation, exercise, social connection, and relaxation techniques. Warning signs. Now, warning signs that often precede strokes: transient vision loss, sudden severe headaches, unexplained dizziness, brief weakness or numbness, and temporary confusion. Report these symptoms to your doctor immediately always. Some people experience subtle changes days before strokes: unusual fatigue, mood changes, trouble sleeping, or vague not feeling right. Trust your instincts. If something feels wrong, seek medical evaluation promptly. After a stroke or TIA, your risk of another stroke increases dramatically. 50% of recurrent strokes happen within 1 year. Secondary prevention through medications and lifestyle changes is absolutely critical. Secondary prevention includes antiplatelet medications or anticoagulants, statins for cholesterol, blood pressure control, diabetes management, smoking cessation, and cardiac monitoring for AFib. Comprehensive care prevents recurrence effectively. Carotid artery disease, narrowing of neck arteries supplying the brain, causes 15 to 20% of strokes. Surgery called carotid endarterectomy can remove plaque and prevent strokes in severe cases when appropriate. Some patients need carotid stenting, placing mesh tubes to hold arteries open. Your doctor determines the best approach based on degree of narrowing and individual factors. These procedures prevent strokes effectively. Recap. Let's recap critical information. Stroke occurs every 40 seconds in America. 75% happen in people over 65. Your risk doubles every decade after 55, but 80% are preventable. Remember FAST: face drooping, arm weakness, speech difficulty, time to call 911. Add B for balance and eyesight. Recognize symptoms in yourself or others and act immediately without delay. Major risk factors: high blood pressure, biggest, diabetes, high cholesterol, atrial fibrillation, smoking, obesity, physical inactivity, and excessive alcohol. Most are controllable through lifestyle and medical management today. Prevention strategies: control blood pressure, manage diabetes, eat Mediterranean diet, exercise regularly, maintain healthy weight, limit alcohol, quit smoking, and take medications faithfully. Simple actions save lives. Call 911 immediately for stroke symptoms. Never wait to see if symptoms improve. Don't drive yourself. Ambulance gets you to proper hospital faster with treatment team alerted and ready. Treatment window is 3 to 4.5 hours for TPA, up to 24 hours for thrombectomy in selected cases. The faster treatment, the better the outcome. Time is brain. 20% of strokes occur during sleep. If you wake with symptoms, call 911 immediately. Advanced imaging may still allow treatment. Don't assume it's too late. Let doctors decide. Remember, stroke is largely preventable. Control your risk factors, know the warning signs, and act immediately when stroke strikes. Small daily actions accumulate into powerful stroke prevention over your lifetime. You deserve to live your senior years with vitality and independence. Protecting your brain through stroke prevention supports the active, engaged life you've worked so hard to build and maintain. Please subscribe for more life-saving senior health content delivered weekly. We're dedicated to providing critical information that keeps you healthy, safe, and independent throughout your senior years always. Stroke is serious, but knowledge is powerful. You now know how to recognize, prevent, and respond to stroke. Use this knowledge to protect yourself and save lives. Until next time, stay healthy, stay aware, and remember, act fast.